Hello everyone, it's Dr. Mohsen Raza. Welcome to my YouTube channel regarding medical updates. My today topic is about ACS, or another name is known as heart attack. So first of all, I will tell you what is the definition of ACS. In the simplest way the simplest definition is the sudden reduced blood flow to the heart muscle. I am pressurizing on the sudden, so if it's not sudden reduced blood flow, it's not ACS. So there are different causes, different signs and symptoms, and different way of treatments depending upon the cause. I will explain it to you one by one. As you know, it's a medical emergency. It's not the simple thing. Actually, it's a medical emergency. It causes severe chest pain, severe chest discomfortness. If you have such symptoms, you should go to the hospital. You should not drive by yourself. You must be taken by the ambulance or by someone else. Now I am going to tell you about different symptoms of ACS. The most common of them is the chest pain. Chest pain is a typical, and it appears like the tightness of the chest. It can be the burning sensation, and it can be a pressure. You feel like the pressure on your chest, that like somebody is exerting pressure with the hand on your chest. And the next one is the pain. The pain starts from the chest. It moves to the shoulder, left shoulder, to the jaw, and to your upper left arm, and between the two scapula on your back. So it's the typical pain of the ACS. It can cause the shortness of the breath, we call it dyspnea. It can cause nausea and vomiting. It can cause you faintness and even syncope, and it can cause lightheadedness or dizziness. And another thing which you can feel in this condition is restlessness. Okay, so there are different signs and symptoms I have explained to you. Most common of them is the chest pain. Now, when to see the doctor? As soon as possible. As I told you before, it's a medical emergency. You should see the doctor as soon as possible. If you have these symptoms, just call the emergency that take to you the hospital. Now, different causes. First I told you symptom, now different causes. The most common cause of ACS can be the high cholesterol level. The cholesterol plaques accumulate in the blood vessel, especially in the coronary artery, which supply blood to the heart muscle. What happen in it? If there is a clot in the blood vessel, the blood flow can split the clots into the small parts, into the small pieces, and these pieces can get stuck into the blood arteries, and that supply blood to the heart muscle. As there is a blockage in the blood vessel, there is no blood flow, no oxygen supply. It results in the death of the heart muscle, and we call it cardiac death or the heart attack. If you survive, it is known as unstable angina. In medical terminology, we call it unstable angina. So there are different risk factors who can suffer from the ACS. So first, one of them is the aging. As you become aged, the chances of ACS become higher. High blood pressure, high blood cholesterol level, cigarette smoking, and lack of physical activity. If you have sedentary lifestyle, there is a high risk of ACS and heart attack. Obesity, if you are overweight, you can get heart attack, because overweight causes the rise in blood cholesterol level. And similarly, diabetes. Diabetes is a major risk factor for the ACS. You can say that like the mother of all diseases. Now, positive family history. If any one of your family member had a positive history of heart attack or the stroke, you can also suffer from this ACS or the heart attack. Nowadays, COVID is very common. It's a pandemic in our society, so COVID can also cause the heart attack. So be careful of that. Now, different way of diagnosis, different way of treatment. I am going to explain you very briefly about these things. So first of all, diagnosis. When the patient comes to the hospital, the most important thing is the history taking from the patient. When you ask the patient what happened, why did you come to the emergency? So patient usually complains in this way: I had a severe chest pain. The chest pain was like someone was exerting pressure on my chest with his hand. I could not breathe. It was a sudden. Everything was just happened in the blink of eye, and the pain was radiating to my jaw, on my back, and on my shoulder. And these are the symptoms that patient explained to you. Alongside these symptoms, he can also say, I had a cold sweating. Okay, sweating, it was cold, it was not like hot sweating. So this is a typical sign and symptoms of the ACS. If he had, so it's confirmed. Okay. The next is a few paramedical things we can perform in the hospital. One of them, the most common, the first foremost, is the ECG. When we take the ECG, it shows the electrical activities of the heart muscle, and if there is any blockage, we can see in the ECG pattern. So the next is the blood test. The blood test show the different type of enzymes which arise during the ACS or the heart attack. The most common of them is the TPI. We actually check in the blood of these patients. So these are the most commonly performed tests. The next are the few radiographies and graphies and few other invasive procedures we perform in the hospital. The most common of them is the angiography, and the next one is the coronary angiogram. Now, what happens in the coronary angiogram? In this process, a catheter or the small, you can say it's a camera. It's moved from the blood artery, from the periphery, mostly from the arms and from the groin region, to the blood vessel of the heart, and it check if there is any blockage or not. The next one is a echocardiogram. Echocardiogram is a camera, it's a probe, it's a device which show the activity or the live picture of the heart muscles. If there is any poor pumping or a poor ejection fraction or the cardiac output, it can be seen in this process. The next one is a myocardial perfusion imaging. In this, shortly, if I say, if we inject some type of dye in the blood and take the picture from a camera, a special device which show the blockage in the blood arteries. The next one is the CT angiogram. It's a CT scan which give us 2D picture of the heart muscle. If there is any blockage, we can see in it. The last is the stress test. The stress test is not in the criteria of the ACS actually. It is performed when the patient is at rest, patient did not have any ACS attack or the chest pain. It is performed during the normal routine activities to check the heart function. So these are the diagnostic criteria. Now, what is the treatment? The target of treatment is to relieve the pain, relieve the discomfort, improve the blood flow, and to restore the function of the heart as soon as possible. This is the target of our treatment. Different type of medications are available, and the most common of them that you should have at the home. And the purpose of this video is this: you should have 3 type of medicine at your home. TNGs, that is the nitroglycerin, atorvastatin, and aspirin. TNG have 2 types. Most common forms are the tablets, which can be placed under your tongue, and it can also have in the form of patches, which can be placed in the axillary region. If you have these symptoms, just take the tablets and put under your tongue. It will dissolve, enter into your blood, and improve the cardiac function. The next one is the aspirin. Aspirin is actually the 100 milligram tablets. You should take at least 3 tablets when you had this symptom, chest pain, and as I explained you before, symptoms. If you had this symptom, take 3 tablets at least at once. The next one is the atorvastatin. It's like 20, 40, and 80 milligram tablets. You can take the 40 milligram at least 2 tablets when you have these symptoms. Other treatment depend upon the cause actually. So there are different type of medicine like thrombolytics, which can be given to the patient who had blood clots in the arteries, which cause the ACS. The next one can be nitroglycerin. As told you before, these are tablets which can be placed under the tongue, or the patches which can be placed under the axilla. Next can be antiplatelet drugs if you had clots formation in the blood. It include aspirin, and it can be clopidogrel, which improve the cardiac function and dissolve the clots of the blood. Other drugs which are used like the beta blockers, most common of them is the nadolol. It can be metoprolol, which can be given to these patients. It improves the cardiac muscle function and increase the output. 2 other common drugs which are given to these patients are known as ACE and ERB. Okay, ACE and ERB, ACE inhibitor and ERBs. ACE inhibitor include like Lisinopril, Benazepril, and these are the commonly used in these patients. It can be herbs like Losartan is commonly used for the blood pressure. It reduces the blood pressure and improves the cardiac function. And the other is a statin. As I told you, atorvastatin is one of them. It reduces the blood cholesterol level and improve the cardiac condition. Other than medication, the last stage, if medicine did not respond, did not control your symptoms, the next stage is the cardiac surgery. Surgery depends upon the cause again, but most common of them is the angioplasty or the stent placing and opening the blood vessel by placing the stents. Or it can be coronary bypass. The most severe condition needs the coronary bypass. Okay, so these are the overall criteria, overall signs and symptoms, and a very brief description about the ACS and heart attack. So take it seriously, avoid high cholesterol foods, exercise properly, regularly, and have a proper checkup if you had positive family history in your family, or you are diabetics, or you had diabetes during the pregnancy. So have a proper regular checkup. Thank you very much for watching my video. If you had any question or comment, please ask in my comments below, and also subscribe my channel for more medical updates. Thank you.